when you went to the doctor, do you take any paper and pen in there to ask any questions? Or did you just, it was just a natural, you know, natural routine visit?
I ask questions.
Okay. Do you feel like do you feel like the doctor answered your question appropriately, or just fed you something just to get rid of you?
I think he answered my questions.
You got a pretty good doctor then.
He knows that I'm a nurse and also the referring physician was a surgeon, was a really good friend of mine. So he knew that he was talking to someone who was medically educated.
Okay. So about how long do you stay in the examining room? But normally it's about 10 minutes.
How long do you do what?
You stay in the examining room.
I guess about maybe 20 to 25 minutes.
Well, that's
He had one of his interns with him, so he was thorough.
Yeah, that's a long time. Normally, a whole lot of times, the doctors, what I have experienced, you know, they set up like 2 o'clock appointments, and they have like 7 people set up for 2 o'clock. And normally, when you walk back there, you know, they do what they have to do, check you out, and next thing you know, they rushing you out of there just to get to the next patient. And some people refuse to ask questions. You know, I learned through the medical field, if you stay in there over 15 minutes, then the doctor have to justify why you stayed that long. And then it becomes a conflict with the doctor and the insurance company. And what I mean by that, you know, they have something called extended visit. So if you stay more than 15 minutes, they got to justify why were you back there that long. And then they send the medical paperwork into the insurance company. And sometimes the insurance company want to fight that. So most of the time, that's why the doctor kind of rush you out of there, because if they can't justify why they had you back in the exam room that long, then they could have problems getting their money from the insurance company. It's a game that the doctor, not really the doctor's fault, but the insurance don't want to pay. You know, they have to just pay for the regular doctor visit, and they just not going to give the doctor extra $25, $30 for the extended visit because they saying it wasn't necessary. Okay. Of course, she introduced me, Garry Jones, worked at several institutions. My last institution was in Tallahassee, Florida. Retired lieutenant. I'm going to start off with the forward page. Matter of fact, let me ask you, how many of you all brought my book? Oh, you didn't? Okay. Some over there. Anyway, we are here by the mercy of God. My journey in life has given me a chance to open my eyes and walk a path that has given me a second chance in life. As you review the pages of this book, you will see the struggle for my good health in my life, my frustration, my disappointments, my hardships, and my pain. As you review the pages, you will also see that we are all alike in many ways because my story is not unlike most people. Let me say that medicine is not an absolute science. The esteemed specialists with advanced training and insight also make mistakes. It is up to you never to accept normal as a diagnosis when you are having problems that you never had before and are unresolved. It is the responsibility of your physician to refer you to another physician who may know a little bit about your problem if that physician is at the end point with your diagnosis. And doctors, they are held accountable because they have to take the Hippocratic Oath. And the Hippocratic Oath is, if you can do no good, do no harm. The fact is, the laboratory test does not diagnose a patient problem. They only confirm the diagnosis. The physician treats the patient, not the test. There will always be false negative and false positive. It is the patient's history and physical examination that make the diagnosis for the doctor. The fact that all the tests that I had to endure were necessary but misleading. Misleading to indicate that nothing was wrong when I had cancer present in my prostate. I thank God every day, and I'm just read a verse from the Bible. Lamentation 3rd chapter 22 to 23 verse, 3rd verse. It is the Lord's mercy that we are not consumed, fail not. They are new every morning. Great is thy faithfulness. Only by God's mercy was I able to preserve and walk down the path of life that delivered me to my salvation. And that was at the Mayo Clinic in Jacksonville, Florida. I want to go back and just go back over the Hippocratic oath that all doctors must take. It's so simple, but it's so powerful. If you can do no good, do no harm. And most of the time, doctor have you back there, keep going back and forth, bring you back. They don't know what's going on. They might have you coming back for the next 6 or 7 months. Then all of a sudden they decide, okay, we'll send you to a specialist. Or maybe you can go to a specialist if you, persist. But if the doctor feels as though you are laid back, not gonna say anything, they just gonna keep on having you coming on in for the visit before they even send you to a specialist. And I had to learn the hard way. If you don't know what's going on, it's nothing wrong with the doctor not knowing what's going on. There's no problem with that. My problem that I had with the doctor was they didn't know what was going on, but they wanted to continue to, make me come back and forth. So the first chapter is called, Did the Burger Make Me Sick? Of course, after I read a couple of chapters, you'll understand where I'm coming from. The year was 1999, and it wasn't a good year for me. I had personal problems as well as health problems. I couldn't get rid of either one. The only thing that was good that year was that I turned 35 years old, and that's when the saga began. Lieutenant John Coleman and I were lieutenant at the Federal Correctional Institution Federal Detention Center in Tallahassee, Florida. We had gone to Rallies, a fast food joint. Some people might, do we have a Rallies here? It's the same thing as the Checkers. They own the same, it's the same business. But in Florida, they call it Rallies. Here, it's the same thing. We both ordered Bit Buford and large fries. I think they had a special, buy one Bit Buford and get the second one free. When we got back to John's house, like always, John would put hot sauce on his fries, something I had never heard of. We both sat back and conversed about what was going on at the prison. It was getting kind of late and I decided to go home. The next day, for the next 13 years, I would battle with an illness that doctors baffled. I awakened with a terrible headache, something that I don't have often. When I urinated, it felt like someone had cut me with a razor blade. I was sweating profusely. I felt chills all over my body. My lower back was hurting so bad that it was hard for me to stand up straight. I figured I must have had a virus or something because I never felt so bad. I can't recall how I got to Tallahassee Community Hospital, which is called Capital Region. I think I may have taken myself because during the school year and my children wasn't around. Neither was my ex-wife. By the time I arrived at the emergency room, I was in so much pain that I had to lie on the floor in a fetal position. After about an hour, I heard the name Garry Jones come from a nurse telling me to come with her. The nurse commenced to ask me, what in the hell do you mean that you think I may have gonorrhea? I shouted. She said, calm down. Mr. Jones, she said, we have to check you out and possibly rule that out, the nurse explained. The only thing that I could think of was my ex-wife asking me, why did they take the test to see whether or not I had gonorrhea? In the back of my mind, I was thinking, when she heard the word gonorrhea, nothing I said or anybody else said would ever register in her mind. That's the only thing she would think about. The doctor came in the room and said, Mr. Jones, you have one of the worst urinary tract infections I ever seen. I said to the doctor, I thought that only women got urinary tract infections. The doctor told me that men could get urinary tract infections as well, but it's not as common in men as it is in women. The doctor prescribed me some antibiotics and pain medication. After the pharmacist filled my prescription, he asked me a question. Mr. Jones, do you have cancer? I said, no. Why would you ask me a question like that? He said, the doctor put you on a large dose of oxycontin. And normally that's what cancer patients take when they are in pain. And I had an epiphany. I thought to myself that it must have been a bit beautiful that I had eaten the night before, because the doctor also said I had a trace of E. coli. I called John to see whether or not he had gotten sick, and he said no. So what's wrong, Garry? John asked. I said, John, I awakened this morning sick as hell. I went to the emergency room and the doctor said I had a trace of 1,000, E. coli, which is an urinary tract infection. And that thing's like so small, the traces of E. coli, that didn't do enough to really basically cause me to get sick. That E. coli could have been in my body the whole time. He said, I'm sorry to hear that, Garry. He said, by the way, I'm on my way to get another bit beautiful. Do you want one? I said, hell no, I replied. Next week, I went to my family physician. He examined me, and he noticed that I still had blood in my urine. He told me if I had another urinary tract infection, he would have to send me to a urologist. 2 weeks later, I developed another urinary tract infection. I awakened the next morning feeling fine. After I got off work, I went to the gym, got my workout on. When I left the gym, I could feel my lower back hurting, and my body began to feel raw all over. I couldn't tolerate anything touching my body. When I took a shower, I began to hurt. Even the water beating against my body felt as if I had fallen down on cement and got skin all over. I thought to myself, I knew I'm not having another urinary tract infection. A couple hours later, I went to the bathroom and started throwing up. And when I urinated, it felt like my penis had been cut with a razor blade and alcohol was being poured all over. That's how bad I was hurting. Again, sweating profusely. I went to the emergency room. Like always, they always took my urine, asked me that same question. Mr. Jones, we have to test you for gonorrhea. You know how embarrassing that is? Every time you go, they're like, oh, we need to test you for gonorrhea, you got the same symptoms. And then after the test come back, oh yeah, bad urinary tract infection. I told them again, I was tired of them asking me, do I have gonorrhea? This time my ex-wife had taken me to the emergency room and she looked at me and asked, have you been messing around? I said, she said, why would the doctor ask you to take a test for gonorrhea? I said, well, I don't know. I told her. When the doctors came in the room, he told me that I had another bad urinary tract infection and confirmed my previous admission that the test for gonorrhea was negative. No blank. I don't see no children around, but basically I said, no shit. Yeah. The doctor gave me another prescription, antibiotics, and pain medication. I informed the doctor that I still had 1 or 2 more antibiotic pills left as well as pain pills. He instructed me to complete the round of antibiotics and start a second round of antibiotics for the next month. I asked the doctor, why do I have to continue to take these antibiotics? And why do I continue to get these damn urinary tract infections? What the hell is really going on? The doctor looked at me without saying a word. I thought to myself, does he even know what's going on? So now I done went through chapter 1, and it's the second urinary tract infection. Within 2 weeks, it's an improvement. I don't have gonorrhea. Each time I got sick, I had a high temperature. When I used the restroom, I used to hate it because I used to burn so bad. And I could see right then that the doctor didn't know what was going on, which I could care less whether the doctor knows what's going on. What I do care about is the doctor, if they don't know, send me to somebody that does know. But the doctor doesn't know. Hold the doctor accountable. But you continue to keep the patient back there and you don't know what's going on. I recommend that you should send the patient to, somebody who, I think sometimes it's an ego thing with the doctor. You don't know. My grandmother once said a long, long time ago, 45 years ago, when I used to go to the doctor and I used to ask questions. And the doctor got, sometimes the doctor got irritated. And then I used to ask my grandma, I said, Mom, I call her Mom. I said, Mom, why does the doctor always get mad when I ask a question? They don't know the answer, Gary. She said just like that, I was a little kid. And after 45 years later, they still don't know the answer. Instead of sending you somewhere else, like I said earlier, they should say. All right, so this is chapter 2. The end year of 1998, I had 2 urinary tract infections. After taking my antibiotics, I began to feel pretty good, but I was still afraid to eat at rallies. I had begun to work out with a vengeance. By now, my family had left me, and I was all by myself. And once again, 6 months later, I became infected with another urinary tract infection. I went to bed feeling fine. Then I awakened around 2 a.m. sick on the stomach and throwing up. And yes, just before I went out urinating, I was burned so bad that tears would stream down my face. My body began to shut down, and I knew something was seriously wrong with me. I went to the hospital again, and it was the same routine. The nurse would say, Mr. Jones, I'm going to test you for gonorrhea. Could you provide us with a urine sample? I gave the nurse what she asked for. And I told her that she was not going to find gonorrhea, but she would find a urinary tract infection. I asked her to give me something for the pain. The doctor walked in and said that the test for gonorrhea was negative, but he had noticed that I had a bad urinary tract infection. Told me to go home, like always, drink plenty of cranberry juice and water, and take my antibiotics until go through your routine antibiotics until completion. I asked the doctor, I said, I'm sick and tired of being sick. Do you know what's going on? I call it urinary tract infection. I thought to myself that they don't know, right? That's why they call them all practicing physicians, because they practice on people instead of curing them. I'm tired of being this guinea pig. I went home, got in bed, and continued to take antibiotics every day for 2 months. That's why I realized, I guess that burger wasn't making me sick. Something else. It was just a coincidence that I got sick. The next day, the night before I ate the burger, I got sick the next day, so I kind of like put 2 and 2 together, thinking that it might have been food poisoning or something like that. Now, now it's something serious now. It wasn't the burger, I guess that's sometimes save work that way, Okay, now chapter 3, urinary tract infections.